Hello friends, today I'll be discussing the topic cellulitis. So let's talk about the definition of cellulitis. Cellulitis is a diffuse inflammation of soft tissues which spreads through tissue spaces along facial planes. It's just like abscess which spreads. So it is not confined to one area, it just keep on spreading through tissue spaces along the facial planes and occupy new areas. The basic causative organism of cellulitis is Streptococcus. If we see the causative organism, it's Streptococcus, and if we see the etiopathogenesis behind this, we see the Streptococcus releases an enzyme called hyaluronidase. Now this hyaluronidase enzyme breaks the hyaluronic acid and fibrin. Now as you can see, these are the bacteria, Streptococci. These are cocci in shape, and they releases enzymes like hyaluronidase. These enzymes gonna break the hyaluronic acid, which is a universal cemental substance. So you see the cemental substance which acts between many things, this enzyme breaks that, as well as the fibrins. They also break the fibrins. Along with this, these bacteria consume lot of oxygen which is present in the surroundings and produce an anaerobic condition. They produce this anaerobic condition so that new other causative organisms can grow. Now we are going to discuss that which areas are most commonly affected by cellulitis. So face and neck are the most commonly affected area by cellulitis. Now there are many causes of cellulitis of face and neck through which it occurs. The very first is very important cause, that is the dental infections. There are so many dental infections through which cellulitis of face and neck occurs. For example, apical abscess. Any sequelae of apical abscess can be responsible for this. Osteomyelitis, that is bone infection. Periodontal infection, any kind of pedial tissue infection. And pericoronitis, which occurs of third molar, maybe partially impacted or partially erupted third molar. So these are the dental infections through which it occurs. Along with this, tooth and jaw fractures are also responsible, and sometimes the usage of infected injection needles are also responsible. Now talking about the clinical features, patient with face and neck cellulitis are ill, has raised temperature, have leukocytosis, that is increased leukocyte in number, and painful swellings of soft tissue. Now the swellings occur due to the presence of edema, and these painful swellings are firm and browny. Now in face and neck cellulitis, when superficial tissue spaces are involved, skin overlying have orange peel appearance. Secondly, the spread of infection can occur along the deeper planes of cleavage, and but the overlying skin may be the normal. So this can also occur like superficially, no such differentiation can be marked, but the infection can go deeper and deeper. Along with this, regional lymphadenitis is also present. Now infection in the maxilla. And now this infection can perforate the outer cortical bone layer, and after perforating, it may lead to swelling of upper half of the face, that is upper half, like upper of nose and eyes and all the above thing. But later on, the diffuse swelling can lead to entire swelling of the face. Now the infection in the mandible, now this is same as that like maxilla, lead to perforation of outer cortical layer and then lead to swelling of lower face. But in the later stages, it doesn't involve the entire face. In later stages, it may spread through superior and cervical, and may lead to further complications like when it's spread cervically, it may lead to respiratory problems. Another important thing to notice is that facial cellulitis, when persists for a longer time, it becomes localized and then lead to formation of abscess called facial abscess. Now this abscess will try to get out and thus discharges from a free surface. Now if we are going to see the histological features, when we are going to see the section of a cellulitis through a microscope, we will see diffuse exudation of polymorphonuclear leukocytes. Along with this, occasionally lymphocytes are also seen. There is some serous fluid as well as fibrins. Now, this diffuse exudation can cause separation of muscle fibers and connective tissue. Secondly, there is also a presence of diffuse acute inflammation. Now, talking about the treatment, in the treatment, we will be taking antibiotics, which will be including some anti anaerobes, because in this condition, anaerobes are being produced, so we need those antibiotics which have some anti anaerobes. Along with this, some of the precautions are need to be taken because sometimes we massage the affected area with some medications, so that should not be done strictly because it can lead to more and more spread as well as inflammation. So in these are some of the treatment. So that's all for the topic, and thank you. And if you like the video, please like and share. Thanks.